Do you have to get a procedure in your girl parts at your local OBGYN and you are freaking out about pain control because all you're seeing are the horror stories on social media? Hi, I am your local OBGYN and let's talk about what options we have. So there's been a lot on social media about how uncomfortable some of these female procedures can be in the office and how gruesome they feel depending on what is done for the procedure itself. I think getting somebody that you trust that is very skilled at the procedure is obviously the best thing, but there are certainly pain control remedies that can be beneficial. All right, so the first thing is, what is the procedure? Is it something just on your cervix or is it something higher up in your uterus? And depending on this, you could ask for a lidocaine injection on the edge of your cervix if your cervix is going to be grabbed, or on the sides of your cervix, which may give you a little bit more benefit at the top of the vagina and up towards your uterus. It's called a cervical block. This will help with manipulating the uterus and kind of wiggling things around. Sometimes we'll even do something to soften the cervix, which will help instruments pass into that sort of donut hole of the cervix itself and reduce the discomfort as well. There's also the ability to use a tiny, skinny little straw-like device and inject fluid that has lidocaine in it inside of your uterus and kind of fill it up just a little bit, like a little bitty water balloon, and just the lidocaine touching the inside of your uterine lining can improve discomfort in the uterine walls as well. There are other things that can be considered. Pre-medicating with something like Motrin won't necessarily help with the procedure itself, but will help with pain and discomfort after the procedure. Some offices do have mini surgical suites where they can give heavier medications. In addition to that, depending on what your nerves are, you may want to ask your provider if they can give you something to calm down so that you're not as worried walking in for your procedure that day.